Let's start, though, with today's vaccine update. After a stumbling start to the vaccine rollout, the federal government has announced that more shots are coming to Canada in the coming months than originally planned. Pfizer will send 10.8 million shots between April and June. That's 2.8 million more than expected. Deliveries are also being accelerated in the third quarter by 6.2 million doses, and the federal government also announced it's buying 4 million more doses of the Moderna vaccine. This means 84 million doses of both vaccines are on track to arrive in Canada by the end of September, and that doesn't include the purchase of millions of other vaccines that have not yet been approved by Health Canada. Anita, Anand is the Minister of Public Services and Procurement. We reached her in Oakville, Ontario. Welcome back to the program, Minister.
Thanks for having me, Catherine.
Now, you certainly had some good news to announce today on Pfizer, but this comes the same day as another poll shows that Canadians are not too happy with how this is going, saying, in fact, that Canada's vaccine rollout compared to other countries is a failure, according to a majority of Canadians, and also that they blame your government. And so I wonder, do you think the news from today ought to be enough to change people's minds?
Well, thanks, Catherine. I'm focused on procurement as opposed to politics, and I would like to say that we are working very hard to ensure that we have the earliest possible deliveries of doses into Canada. There were retooling of the plants in Europe, and that did slow deliveries temporarily over the past few weeks. But we're going to be receiving 400,000 plus doses into this country every week going forward from February 15th onwards to reach our 6 million target by the end of March. And then in the second quarter, we're going to be receiving 23 million doses of Pfizer and Moderna combined. And then by the end of September, 84 million doses of these vaccine suppliers. And so as we move into the final weeks of Q1 and into the spring or Q2, we are going to see a significantly steep ramp up of vaccines in this country so that all Canadians who wish to be vaccinated will be vaccinated even earlier with these new announcements today.
Even earlier. Are you moving up that September target?
We are on track for the end of September at the current time, but as you can see from today, we are continuing to get earlier deliveries. So now we can say that with these 23 million doses into Q2, we will be able to inoculate 11.5 million Canadians, which is a different number, an accelerated number from our previous estimation.
Okay, well, I do want to ask you, though, about what's happening with Moderna right now. I appreciate wanting to talk about the medium term, the longer term, but we know the next shipment from Moderna is actually going to contain 82,000 fewer doses than the previous one. Your government keeps saying you have assurances you can reach that 2 million dose target for the end of March. Everyone says they are so sure, but you can't put out a delivery schedule. So what's up?
Well, let me just assure you that I have been speaking with the executives at Moderna this week and reiterated the importance of having the remaining 1.3 million doses of Moderna coming in to Canada to meet the quarterly target of 2 million doses. And the supplier has assured me that those doses will arrive in Canada prior to the end of March, and in turn that they will be meeting their contractual commitment. With that assurance, I am now telling you exactly what I know. There is a temporary delay in the deliveries of Moderna while they retool their Swiss plant, and that's to be expected as we have these industries ramping up to peak production, and indeed all countries being serviced by Moderna and their vaccine are experiencing this similar situation. This is a global effort, and countries around the world are expecting the same doses from the same suppliers, and therefore we are going to make sure that we receive our allocations, but by the same token, we have to remember we are just 6 weeks into this inoculation campaign. We will be going forward with a significantly steeper ramp up in the weeks and months ahead.
Okay, you make the point that everybody around the world wants this stuff. I thought it was very interesting when you revealed today that Canada's AstraZeneca doses are actually going to be coming from the United States. Have you or will you push supposedly our closest ally to secure more vaccine doses manufactured in the U.S. despite that executive order? Could we be seeing more U.S. supply? Yeah.
Oh, sure. Thanks, Catherine. I have continually said that I and our government have left no stone unturned in terms of what we will do to accelerate doses and to obtain additional early doses for Canadians.
So you have asked? That means that yourself or perhaps the Prime Minister has asked the Americans about this?
We both have been on the phone relating to the accessing of doses from the United States. I've spoke with Jeffrey Zients, the vaccines are in the United States, and I've spoken also numerous times with our ambassador, Kirsten Hillman, and we are definitely pursuing a possibility of accessing U.S. doses, but at the current time, those doses have been reserved for U.S. citizens, but that doesn't mean we're not having that conversation and ensuring that Canada is well placed if that situation changes from the U.S. perspective.
Did the Prime Minister ask President Biden directly?
I'm not privy to the precise conversation between the leaders of our countries, but I do want to emphasize that that is part of the ongoing conversation that we're having with the United States across the board, across numerous ministers and officials, as it is so very important.
Okay, I want to turn to the question of rapid tests, which has also been a big subject of discussion. Ontario Premier Doug Ford saying just this afternoon he wants more tests. Now, we know that Ontario's actually only used a fraction of the tests that they procured from both the federal government and on their own. Certainly, it's less than half of even what you've sent. Are you willing to provide Ontario with more rapid tests?
So I am in charge of procuring a number of items, PPE, vaccines, and rapid tests. And early on this pandemic, when we heard, especially from the provinces and territories, how desperately they needed these tests, we moved very quickly and we put into place contracts for the procurement of over 40 million rapid tests. Over 20 million of those tests have been delivered to the provinces and territories. We are continually supplementing those deliveries to the provinces and territories as they come in because we want to support their efforts. In addition, we provided under the Safe Restart Agreement over $4 billion for rapid tests, for contact tracing and testing supplies and the like. So, Catherine, from a procurement perspective, we will be there for the provinces and territories and Canadians at large, but we would also like to see those tests being used.
Is there any universe? I mean, some of these provinces we're talking about like a fraction of 1% of rapid tests that are being used right now. Is there ever a scenario where you ask for them back so that they don't just expire on a shelf?
Well, that's a very good question, although it is somewhat outside of my portfolio as I'm buying these tests and then we provide them to the Public Health Agency of Canada, and then they provide them to the provinces and territories on 80-20 split basis. And so, to my knowledge, that is not part of the conversation at the current time, but I'm not the person on the front lines in that discussion.
Okay, the last topic I want to ask you about today is travel. You were part of the government's announcement today. I'd like to know a little bit more about this policy when it comes to quarantine hotels and specifically the exemptions. If someone is traveling for a non-elective medical procedure, so they have to go to the United States for cancer treatment, for instance, do they have to stay in a quarantine hotel?
My understanding is that there are still some items to be worked out in terms of the processing of applications. This is a completely new system for Canada. We are going to be setting up a system of administration so that the processing of these types of applications can occur. But at the current time, my understanding is the general bulk of people should not be traveling for non-essential purposes. And if it is essential, there is going to have to be this PCR test on arrival and then quarantining while the test results come back. And that's what I know right now. And as more information comes available regarding the specific types of instances that you're mentioning, we'll definitely clarify that.
I appreciate that there is still work to do, but I guess I want to ask you above and beyond that. Do you think it's acceptable that someone crossing the border for life-saving cancer treatment, for instance, have to pay $2,000 to stay in a quarantine hotel? Do you think that's okay?
Well, the purpose of these provisions and new rules are really to protect the Canadian public at large. And we've heard from Canadians across the country that they want this government to be stronger in terms of the border measures that we are taking. Of course, in the life-saving circumstances, it is understandable that these are very difficult, and I'm very hopeful that those in charge of making decisions relating to quarantining take these types of circumstances into account. Both of my parents actually have had cancer, and I very much appreciate the difficult circumstances that that disease poses for Canadians.
Okay, I guess just in closing, I appreciate that you are being careful about this and that things are being sorted out, but at the same time, there are people in the situations we just described. The Conservatives have raised the question of unaccompanied minors. There are people who are traveling because they have a parent who is dying, might be at the end of their life, and they're looking for certainty right now. And all they're hearing from the federal government is, we're working on it, it's going to be on a case-by-case basis. So what would you say to those people?
I would say that this is the first ever type of program that we have implemented in this country, and it is complex, while at the same time necessary to protect the health and safety of Canadians. And there will be a number of cases that need to be adjudicated or decided in terms of what the particular rules are that apply to that particular case. But what we wanted to do today is to put forward our plan that states, generally speaking, you're going to have to be quarantining for these number of days while you're waiting for your PCR test. And then on a case-by-case basis, we're going to have to allow the Public Health Agency of Canada and the officials running this program to make those decisions.
Okay, we're going to have to leave it there for today, Minister. Thank you for your time.
Thank you so much. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.